Welcome to the PD Pet Care Vlogs. I'm Dr. Cath Watson, and today we're going to talk about diabetes in cats and dogs. Now, there's actually different forms of diabetes. We tend to think of diabetes as being sugar diabetes, so when blood sugar levels are too high and we have a relative or absolute lack of insulin. However, there's another type of diabetes called diabetes insipidus, which deals with a different hormone, the antidiuretic hormone, which influences essentially our thirst. And in this case, there is not enough of that hormone, or there's a resistance to it. So the symptoms can be similar. However, it is not a sugar-related disease. It's quite rare, so diabetes insipidus is quite rare. So I'm not going to talk any further about that. We'll just talk about sugar diabetes today because that's what most people think of when you use the term diabetes. So both cats and dogs can be affected by diabetes mellitus, sugar diabetes, but they're affected differently. So in humans, we talk about type 1 diabetics, who this is primarily a genetic disease. The pancreas actually can't produce insulin. And insulin's important because that helps drive glucose from our bloodstream into our cells and essentially feeds us. So without insulin, we can have lots of glucose circulating in the blood, but otherwise we're essentially starving. So type 1 diabetes, typically more a genetic disease, and that's primarily what dogs get. On the other hand, when we talk about humans, we also have type 2 diabetes, which is much more a lifestyle disease. And this is where the pancreas can actually still produce some insulin, but it's essentially exhausted. And there's a bunch of factors that influence the development of type 2 diabetes. Obesity is certainly one of the big ones, diet, lifestyle. So this is more what cats are affected by. There's the odd cat that can be type 1, but most of them are type 2 diabetics. So why does that matter? Well, when it comes to dogs, because this is primarily a genetic issue, there's actually very little that you can do at home that's going to be able to prevent the development of diabetes. So it's important to understand that there are some breeds that are more at risk. So Australian Terriers in particular, Schnauzers, Bichons, Fox Terriers. Intact females also seem to be at a higher risk. So when they come on heat, all those hormonal changes are actually much more likely to trigger the onset of diabetes. And it may well go away when they come off heat, but while they were on heat and all those hormones floating around, that diabetes can be quite difficult to control as well. So because it is primarily a genetic disease, not a whole lot you can do about it other than neutering, really good idea for female dogs. You can, to a degree, manage their diet if they're prone to pancreatitis, so inflammation of the pancreas, which is the organ that produces insulin. So by managing the diet for dogs that are prone to pancreatitis, reducing their fat levels and so on, reducing the risk of developing pancreatitis, you may slow down the development of diabetes if they are genetically prone to it anyway. So the symptoms we'd expect to see with diabetes in dogs, typically they're drinking bucket loads, they're peeing bucket loads and probably can't go through the night without needing to go for a pee. Often they're really, really hungry, but at the same time they lose weight, and that weight loss can actually be quite dramatic. They can also be they can be more prone to infections, so skin infections, bladder infections, and sometimes you'll see changes to their coat, so their coat might end up a bit greasy or dry, skin not looking as good as it should do. If the diabetes goes undetected in these early stages, and the symptoms can develop quite quickly, so if you haven't noticed that they're drinking more, peeing more, losing weight, eating heaps, then they can go on to develop a condition called ketoacidosis, which is essentially where, because the cells of the body are starving because they're not getting that glucose from the bloodstream into the cells, the body then tries to break down muscle and fat and all the rest of it, and it can't do that so effectively and ends up producing these ketones, which are a byproduct. And too many ketones end up becoming toxic to the body. So they end up in this ketoacidotic state where they'll end up feeling pretty toxic. So start vomiting, have diarrhea, end up collapsing, and it can certainly lead to death. So that's getting pretty serious by the time it gets to that point. So please, if your dog's drinking a lot, peeing a lot, hungry, losing weight, go and see your vet, because it's a pretty straightforward diagnosis. For cats, it is not so much a genetic disease. Type 2, like humans, much more lifestyle disease. So cats that are obese are 4 times more likely to develop diabetes mellitus than your ideal body condition cat. Cats are also prone to pancreatitis, and they can get this kind of low grumbling pancreatitis, so inflammation of the pancreas, and that can then interfere with insulin production. So a relative lack of insulin can then lead to developing diabetes mellitus. There are some other diseases like hypothyroidism which can make them slightly more prone. There are also medications in cats, so particularly long-term use of steroids, which we see in some cats for things like oral inflammation, skin diseases, that can certainly make them more prone to developing diabetes mellitus. The symptoms, basically the same as in dogs. They drink a lot, they pee a lot, they're hungry, they're losing weight, coat often ends up looking a bit rough, prone to infections, particularly urinary tract infections, bladder infections, and they're also often quite weak. As far as treatment goes, for all dogs, they need to be on insulin. The type of insulin you'd need to discuss with your vet, but usually you end up giving injections twice a day. It may sound really scary, but it's something most people get to learn to do, and the dogs don't mind at all. It's usually very straightforward, but it does need to mean a very consistent routine for yours and their lifestyle. And the treatment is for life. There is no recovery from type 1 diabetes. It means permanent treatment. For cats with type 2 diabetes, most of them are also treated with insulin, and that's often once or twice a day. However, there can be other options. So there is an oral medication called glargine, which can be used. And I say oral medication, obviously that means you have to give the tablet orally, which may or may not be a problem for you with your cat. So that's one consideration. Generally, they can't be managed with diet alone, but cats can be very frustrating in that because you're talking about a pancreas that's essentially exhausted, sometimes when we treat them for diabetes, they'll appear to recover. So the pancreas regains that ability to produce insulin, and so they may become non-diabetic again. So you just need to bear that in mind when we're treating cats, that we may actually get resolution of the diabetes, which is awesome. So as far as prevention for cats, obviously preventing obesity is the really big one. So diabetes, not so different to humans. It's just that dogs are like type 1 diabetics and humans, cats are like type 2. Not much you can do about the type 1. Type 2, definitely all about lifestyle.